Mr. President, first I want to say to those of you who think we're starting a little late, it is not because a few of us were invited to go have lunch with President and Mrs. Kagame at their beautiful lakeside farm. No, it's because before we could eat a bite, he took us on a detour so that we could see one of the model villages now being built all over Rwanda to give poor farmers a decent home, access to electricity, the children access to schools. And what ruined it for us was, in this particular village, there were a lot of dairy cows. And President said, you know, giving one dairy cow to every Rwandan had a lot to do with our lifting so many people out of poverty, 1 million people out of poverty in 5 years. And since I grew up in a farming area, lived on a small farm as a small boy, actually was nearly butted to death by a ram when I was a child, we spent too much time with the cows. For that, I deeply apologize, but it was wonderful. Governor, Mayor, Dr. Dukandani, thank you very much, Sister Epiphany, for your leadership in the School of Nursing and Midwifery and for welcoming us here. To all the people who played a role in this today, especially to our magaziner and all of our friends at the staff of the Clinton Health Access Initiative, to my great friend and colleague in places all across the world, Dr. Paul Farmer, Ophelia Dahl, and the people with Partners in Health, the people from the Harvard Medical School, and those of you who were students and staff of the nursing school, I thank you. I want to say a special word of appreciation for the leadership of President Kagame and my friend, your minister, Agnes Binagwaho, who's worked with us for 10 years since we first began trying to tackle the AIDS problem in Rwanda. It has been a great honor for all of us to go along as small supporters on the grand journey of this country. And for my friends who came with me from the United States and to support the work I try to do around the world, consider this. Since 1994, at the end of the genocide, life expectancy has climbed from 28 years to 55 years, almost double. 90% of Rwanda's school children, 2 years of age or younger, have been immunized against all major childhood illnesses. That did not happen in the United States until the end of my first term as president. We didn't get to 90% in our whole long history. Maternal mortality has dropped by 60%. When we first were invited here to work on AIDS, only about 800 people who needed the antiretroviral drugs were getting them. A decade later, more than 100,000 people living with HIV in Rwanda are receiving medicine. That is more than 90% coverage of the population in need. That too is a higher percentage than the coverage in the United States. Since 2007, morbidity related to malaria has decreased by half among children 5 years of age and younger, and by half among women under 50. There's been a dramatic decrease in waterborne diseases. And yesterday, when we were at the hospital in Butaro, we learned that vaccination against the HPV virus to prevent cervical cancer in women now extends to more than 93% of the women at risk by age in Rwanda. The current United States HPV vaccination coverage ratio is 26%. And along the way, while you had nothing else better to do, in the last 14 years, Rwanda has increased its per capita income 5 times over. You should give yourselves a round of applause. President Kagame and I were laughing about our rural roots. Where I come from, there is a saying that if you find a turtle on a fence post, it didn't get there by accident, since they can barely move and certainly not climb. Rwanda did not get there by accident. You had a vision of what it would be like to be a country where people live together in peace and harmony, and every single person's talents, men and women, were tapped, and every child had a chance to live up to his or her own potential. You had a strategy to get there, and you have executed that strategy with the discipline and passion, as far as I can tell, unequaled anywhere in the world. That is an enormous credit to the leadership of President Kagame, and in the health area, to Minister Beniguano. I love her. She is so good at what she does. And she has the essential characteristic of all good leaders. She can make you do what you don't want to do and smile while you're doing it. So today we're here to talk about something that will take the next step, something that is profoundly important for Rwanda, but also maybe over the long run of even greater importance to the United States. And I would like to explain why. Rwanda has developed a decentralized health model that places professionals in more than 40 hospitals across the country. It has led to a 4-fold increase in people receiving primary care in the last decade. And even as that continues to increase, there is also a great recognition that in Rwanda, as in so many other countries in the world, there are people here who need specialized care who previously could not get it. That was the whole purpose of going to dedicate the hospital yesterday in Butaro and talking about the cancer wing and seeing people who were being treated properly and well and whose prospects for recovery were great here. There are more cancer cases now in the developing world than there are in the long, wealthy countries. And for too long, there has been nothing available to help them. Now, thanks to Minister Beniguano, there will come a time, I hope in the not too distant future, that Rwandans will no longer have to leave the country to get the advanced care they need, and people will be coming to Rwanda from other countries to get the care they need. This started, as I said, in 2002 when we began to work on AIDS. In 2004, with the support of the government of Rwanda, our magaziner invited our friend, Dr. Paul Farmer and Partners in Health to Rwanda to help develop model hospitals and care and treatment systems in rural areas. He wound up moving here with his wife and child and falling in love with your nation as everyone else does. 2.5 years ago, the government asked us to assist them to become the first country in Africa with a sustainable world-class health system that can be run without 1 red cent of foreign assistance. Now, the key to achieving this is, first of all, to have a delivery system that's affordable. The President and Minister believe we have one now. A hospital in every district, satellite clinics, thousands and thousands and thousands of community health workers, and increasing concentration to have more skilled areas. Second, you have to educate enough doctors, nurses, health managers, and other workers, and create a medical education infrastructure that can continue to do that. So when the minister asked our foundation to help develop a national human resources for health plan with specific, well-defined goals to increase this healthcare workforce, we were honored to do it. And we have been honored to work with the United States Center for Disease Control to lead the technical working group on this HRH, Human Resources for Health. Not His Royal Highness or Her Royal Highness, Human Resources for Health. And we've had the full participation of the School of Medicine, the professional associations, the nursing schools, the Kigali Health Institute, the School of Public Health, and others. The government has produced an inspiring plan. Minister Binagwaho told us that foreign assistance for health education traditionally had very serious limitations. If you get money to buy AIDS medicine and a good contract's negotiated for you, you just take the money and buy the medicine. But training people is a whole different thing. And traditionally, when health professionals come from other countries to do training paid for by the foreign assistance budgets of other nations, they had come to Rwandan hospitals and schools for short amounts of time, sometimes 3 months, sometimes as short as 1 week. This model was not sustainable to really give Rwandan students and educators what would be necessary for them to have the world-class program they wanted. What was needed was a long-term partnership with a shared sense of responsibility to bring the most highly trained faculty of medicine, nursing, and health management for an extended period of time to Rwanda. The program's goal is to establish a critical mass of skilled doctors, nurses, and health managers who can then train the next generation of Rwandan professionals. The health ministry has even identified the specialty areas where we need to do better: internal medicine, pediatrics, obstetrics, gynecology, anesthesiology, surgery, pathology, and emergency medicine. This program will help to train more than 500 doctors in these areas. The Ministry of Health has also done a lot to increase the skills of nurses and midwives. Now the program will provide the opportunity for 5,000 nurses to be upgraded to the 8-1 training level. More than 2,000 of them will be trained in specialties like oncology and pediatrics. E-learning strategies will be used to help grade the skills of a major portion of your nurses. And ultimately, the nursing schools will be strengthened both to increase enrollment of nurses and to produce nurses with greater skills. At the request of the Ministry of Health, we began to establish academic partnerships with top-ranked schools in the United States to provide faculty to Rwanda on long-term assignments, a minimum of a year, not a maximum of 3 months. Now, nearly 100 American faculty will be based in Rwanda each year to work with your faculty in these areas. Each U.S. faculty member will be paired with a Rwandese faculty member for a year to transfer training capacity. The government also wanted to tackle the current inefficient foreign aid model, and to be fair, so did we. This is not just true of the United States. Most Western foreign aid spends a very high percentage of money appropriated by their parliaments on overhead costs that go directly to institutions and NGOs from the donor countries. And the money which the taxpayers give to help people in Rwanda or anywhere else often doesn't reach them because the overhead and the administrative costs are diverted to people in the donor countries. Often, it can be even less than 50% of foreign assistance actually spent directly on programs and people, with the rest being spent on administration or overhead. So what CHI did was to approach a number of leading medical, nursing, and health management schools on behalf of the government here, asking for a long-term commitment and a commitment at lower cost. We explained that this was a huge job and it would never get funded if we had the traditional overhead system. I think the response was overwhelming and highly admirable. Harvard, Yale, Brown, Dartmouth, Duke, Columbia, the University of Virginia Medical Schools, New York University, the University of Illinois at Chicago, Howard, Duke, University of Maryland Nursing Schools, the Yale School of Health Management, all agreed to participate and to waive the 25 to 30% overhead that they would normally get for doing this kind of work. And listen to this, to contract directly with the government of Rwanda and commit themselves to operate this program at an administrative cost of 7%. It is unheard of anywhere in the world. And this will be the largest medical education project ever undertaken with foreign assistance, and the first time so many universities will work together under the leadership of the government where they're working, your government, and to work according to its plans to transform the nation's healthcare system, not something somebody else somewhere else decided might be a good idea to do in Rwanda. To implement the plan, the government of Rwanda had to convince some of the largest donors, especially the U.S. government, to support the plan. They actually offered, the government of Rwanda did, to give up funding for some existing programs so that the money could be redirected to develop the health resources that your future requires. And I have to say, I'm very grateful to the U.S. government, to the State Department, which I happen to think is very well led, to USAID, and to the Global Fund, which has also agreed to support this endeavor. I want to thank Ambassador Karan and colleagues here in the audience from USAID and the Center for Disease Control for grasping the critical importance of health education at this moment and for supporting the Rwandan government in this endeavor. The students, the doctors, the nurses who will be participating, I want to say that you are going to be part of something that is historic for you and for us. That within 7 years we'll create the first world-class health system in Africa, and to do it on terms that will enable you to hold it together and keep making it better in the future. By the end of the program, I think you will have permanent relationships with these American universities on equal terms, working together, and that you will have established a whole new model for how foreign aid will be spent in the future. A future in which we want broadly shared prosperity in the world, and we want not to waste $1 of the donor taxpayers' money, which should be spent to empower the countries where the money is supposed to be directed. So, again, Rwanda is leading the way, proving that ownership of such initiatives in the country where the people live and the leadership of assistance programs can be both the most efficient and the most effective way to bring results. So, Mr. President, thank you. Madam Minister, thank you. Once more, I believe Rwanda will succeed. And I believe when you do, within 7 years, you'll be running a health system without foreign assistance that will be the envy of Africa, unless everybody figures out what's going on in time to copy what you're doing as quickly as possible, which I know, Mr. President, you would like to see done. One of the many things I admire about Rwanda is that you never seek to hold anybody else down. You just try to get your people ahead. And you hope others will also do what works. So, I thank the 13 schools who will participate in this. And thank you especially, Paul Farmer, for the work you did with Partners in Health and the Harvard Medical School for your leadership and stepping up early and getting all the others to take this enormous commitment on. The students and teachers in the room today will ensure the success of Rwanda's tomorrows. Over the course of the next 7 years, I think Rwanda will become a health education hub in Africa. I predict you will be training healthcare professionals not only from Rwanda, not only from Africa, but I think people will come here from all over the world to study this model of training and implementation. And I am profoundly grateful, again, that you have permitted us to be a small part of it. This is a really good day. But the really good days will come when you save more lives and give more children a bright future. Thank you very much.